I'm Brittany Lewis with Forbes Breaking News. Senator Tammy Baldwin spoke with drug policy experts about fentanyl and opioid addiction during a Senate Help Committee hearing on Tuesday. Baldwin raised concern about Congress not doing enough to warn young people about the dangers of counterfeit pills laced with fentanyl. She asked officials how the DEA and CDC can work together to promote their campaign quote, "One pill can kill." She ended her line of questioning by stressing the importance of having naloxone available, a medicine that rapidly reverses an opioid overdose. Here's more from the Wisconsin Democrat.
Thank you, Madam Chair. I'm listening to my colleagues as well as the responses, and there's sort of a pattern that I have observed over time. When we were talking in this committee about the opioid epidemic just several years ago, it was much more, the conversation was much more focused on prescribers and overprescribing and 30-day supply after dental surgery rather than something that would be much more appropriate to avoid substance use abuse. Now we're talking a lot about accidental overdose and getting folks who have gotten fentanyl-laced pills, et cetera. I'm like my colleagues, I want to share the stories of several Wisconsin families that I've gotten to know this year because they've gone through this crisis themselves. Cade Reddington was a graduate of Waunakee Community High School, a student at UW Milwaukee, and a kid who was full of life and energy and excitement. On November 4th of last year, Cade died in his dorm room after taking what he thought was a Percocet pill. That pill contained fentanyl. Combating fentanyl is a critical task for this committee and this entire administration. But I'm concerned we're not doing enough to warn our nation's young people about the dangers of counterfeit pills. So Dr. Jones, I wanted to just draw your attention to the work that, and I'm sure you know about it, the work that the DEA has been doing to spread the word that, quote, "one pill can kill." This message, in my mind, has not yet been shared widely enough. And so I wonder how the CDC is working with the DEA to elevate this particular message and make sure that this information is being shared with young people.
Great, thanks so much for the question. And we worked closely with DEA before that campaign was launched because we have experienced over the last several years multiple campaigns that we've done at CDC around prescription opioids, transitioning to recovery, and now the illicit fentanyl market. So we had learned lessons along the way about how to communicate and wanted to make sure that we could assist DEA in their messages. So we worked with them prior to the launch, and we certainly worked across agencies here with DEA to help disseminate those messages. I think that campaign is an important one because it is very catchy. One pill can kill, that makes sense. And that's something that is not lost on people. And it does reflect the toxicity of the illicit drug market. As many senators here have mentioned today, the issue of poisoning versus overdose. And I recently participated in a DEA event that brought families together who have lost individuals through those exact scenarios, taking counterfeit pills that they thought was Xanax or Percocet and was actually pressed fentanyl. But I think I'll highlight two things at CDC that I think complement the work of DEA and how we can continue to spread these messages. So the first is our Stop Overdose campaign, which I mentioned in my opening statement, which focuses specifically on fentanyl and the toxicity of the illicit drug market, the availability of naloxone, probably substance use, which is also contributing to overdose, as well as unintentional exposure, people thinking they're using something else and they're actually getting fentanyl, and then decreasing stigma, which we know is a barrier for people to seek help. That campaign was formally tested among young adults, 18 to 34-year-olds. And so that is something that is freely available. People can take what we've done and use it and apply it in their communities. So that is, I think, a new asset that is available to help spread the message about the toxicity of the drug market. And the last thing I'll say is that there is a real opportunity to focus on upstream primary prevention. We need to get messages out about the toxicity of the drug market, but fundamentally, as a long-run strategy to addressing this issue, we need to help instill resilience, life skills, problem-solving, conflict resolution, focus on root causes like adverse childhood experiences that really set the trajectory for someone to have risk for substance use. We know that people with ACEs initiate substance use earlier, which increases your risk of having a substance use disorder. So there are really powerful opportunities for public health prevention in that space.
Thank you, Dr. Jones. And I didn't want to cut you off because this is very responsive to my question. I will do as Senator Collins did and submit some questions for the record, but I did want to indicate that both Cade, who I just told you about, and Nicholas Barrett Graves of Beloit have passed away of fentanyl poisoning. Nicholas of Beloit, Wisconsin, could have been saved by naloxone, as could have Cade. And that's why I've been pressing manufacturers to make their products available over the counter and working on legislation to reauthorize the opioid overdose reversal medication access and education grant programs. So for Dr. Delphin Rittman, again for the record, I'll be inquiring what SAMHSA needs to make sure that naloxone is more readily available to first responders and in key locations such as school dormitories and community centers. And that'll be submitted for the record.
Thank you. Senator Braun.
Thank you, Madam Chair.